My name is Hala Borno. I'm an assistant professor of medicine at the University of California, San Francisco. I'm in the Division of Hematology Oncology, and I'm a medical oncologist practicing genitourinary medical oncology at the Helen Diller Family Comprehensive Cancer Center. So immunocompromised means having a weakened immune system. And when you have a weakened immune system, you may be more susceptible to an infection. You can have a weakened immune system for a variety of reasons. Sometimes it can be innately immune. And so this is something that is, due to the biology of a person that increases the risk of infection. And sometimes it's something that can be acquired. And there are a number of factors that a medical oncologist has to consider that can lead to an acquired uh, immunocompromised state. This could be due to an actual drug and drug-associated toxicity. This could be due to radiation, which can lead to a reduction in the production of cells that are associated with the immune system. Or this could be due to, nutrition. These are just a few examples of factors that can contribute to a reduction in someone's immune system, which thereby can increase their risk of infection. A history of cancer in and of itself does not necessarily increase the risk of an individual having a health complication due to COVID-19. However, we know that patients who have had prior treatments for cancer may have, various complications associated with those prior treatments, which may change their risk uh, profile at the time of infection. So, for example, if a patient had, a prior history of lung cancer, and that lung cancer was either treated with radiation or a surgical approach, that prior treatment may reduce that patient's lung capacity or affect their baseline respiratory function. And as a result, if they acquired an infection that affects the lung tissue, they may, as a result, have more symptoms and more risks associated with that infection. So the risks associated with COVID-19 for patients with cancer really need to be thought about in a case-by-case fashion based on, what the cancer was, the types of treatments received, and the current condition of the patient. The advice that I have for patients that are on oral cancer therapies is for them to talk to their medical oncologist about the mechanism of action of those oral therapies if they're not already familiar with that mechanism of action, and to think through the common side effects of those therapies. Not all oral therapies lead to a compromised immune system or affect the immune system. Some oral therapies may be hormonal in nature, in which case, the thinking of a weakened immune system is not um, as much of a concern. Some oral therapies can, in fact, make patients have an increased risk of infection. And so really it depends on the type of therapy, but patients should discuss this with their medical oncologist to try to understand their particular situation. Regarding whether or not to postpone treatment, um, new treatment for a diagnosis of cancer, it really is a question that needs to be taken on a case-by-case basis. Certainly, we are dealing with a risky global environment in the context of COVID-19, so you do need to think about the risks of, presenting to healthcare facilities to receive care versus the risk of cancer progression. And cancer, as you know, is something that is quite heterogeneous, and different tumors may have different behavior. Some may be more indolent and some may be more aggressive. Patients may be asymptomatic or patients may be symptomatic from the cancer. And so depending on a constellation of factors, those things need to be considered together in order to shape a patient's decision on whether or not to pursue therapy. Not all therapies require frequent presentation to a healthcare facility. Not all therapies require, intensive blood monitoring. And not all therapies are immunosuppressive. And so, depending on the risks associated with therapies, that too has to be considered when guiding scheduling of therapy initiation in the context of COVID-19. Now, to answer a question posed by a survivor about the role of surveillance and imaging in the context of COVID-19, there are a few things that need to be considered. One is, how long ago was the cancer treated? Is this a situation where a patient is a survivor and received therapy for the tumor 10 years ago, or is this a situation where the treatment was completed 6 months ago? Certainly, patients who have just completed therapy may have a tumor that has a high risk of recurrence within 1 to 2 years. That is a scenario that needs to be thought about a little differently than a person who completed therapy 10 years ago and has not had any symptoms or any signs of recurrence. So it really depends on how far out an individual is. And then also, of course, the tumor itself. Was the tumor, more high risk at the time of diagnosis, or did it have low risk features, and is the probability of achieving cure quite high? Those things also need to be taken into account.